The next manual muscle test that I'll be discussing is the serratus anterior assessment. With this one, we are assessing the downward rotation and abduction of the shoulder joint. So muscles that will be assessing the serratus anterior, we're going to ask our client to sit with proper posture, shoulders in neutral, chin in neutral, trunk in neutral, seated kind of maybe at the edge of your table. And we're going to ask them to, or we're going to kind of passively place them, their shoulder inflection to at about 120 to 130 degrees. You can have them close their hand or have it open, whichever one. Thumb kind of wrapped around the finger if it's going to be closed. Thumb facing the ceiling, but the bottom of the knuckle facing down. Then you're going to hold on to the inside of their armpits with one arm, your supportive hand, and then your pressure hand is going to be on the top of the arm near the bicep. And you're going to ask them to hold this full shoulder flexion position while you apply downward pressure. If they are unable to hold this position, we're going to consider that muscle weakness and you're able to get them back down, so shoulder extension. Then we're going to call that a 1, and that would be muscle weakness. If there are signs of compensation, such as shoulder elevation or trunk flexion, then we're going to assess them as a 2. And then if there are neither one of those, then we're going to grade them on a 3, according to the manual muscle grading scale. If there are signs of compensation or muscle weakness, we can look at some underactive muscles. So we can look at muscles that may be underactive, and that would be the pectoralis minor, the mid traps, and the rhomboids.